All right, this slide is a lot like the previous slide for some reason. But we do add, you always use gloves to apply meds to the skin or any kind of a transdermal patch. Especially transdermal, you don't want to absorb nitroglycerin or nicotine through your skin. You know, you can absorb the nitroglycerin and all of a sudden you have a massive drop in blood pressure and you pass out in your patient's room. That has been known to happen. So always make sure you protect your skin by wearing gloves. Box 4.2 on page 56 gives all your little guidelines to giving percutaneous medications, so make sure you read that. And once again, percutaneous is either topical or transdermal. Clean skin before the application, make sure you're using gloves. If you are applying ointments or lotions, you want to use either a tongue depressor or a cotton tipped applicator, maybe a cotton ball. Follow the instructions. Some medications you're going to rub into the skin, others you're going to apply it and then either wipe off the excess or not. You might apply it and cover it with a dressing, or you might apply it and leave it open to air. It's very, very important, especially for those of you doing home health, that you give the patient the patient and their family a lot of education on how to give topical meds so that when you're not there, they or their family members could administer it correctly. When you are giving medications to the mucous membranes, eyes, ears, nose, vaginal area, remember, if something has an oily base, it allows for slower absorption. It takes longer to absorb into the skin. Sublingual is considered to be topical, but bypasses the liver and goes right into the bloodstream. So it's really not the same as transdermal because it's not in the skin, but it is in the mucous membranes. So if you have a med that's meant to be given sublingually, you're going to put it under the tongue. Buccal, you can also put it a tablet, a rapidly dissolving tablet, in between the cheek and the gum line, and you can also give something like nitroglycerin this way. But it's not considered to be enteral because it absorbs into the bloodstream. It goes immediately into the capillaries in the mucous membranes, lots of capillaries in the mucous membranes, and gets into the bloodstream rather than having to go into the stomach and through the liver. If you are giving a vaginal topical, the patient should lie down for 10 to 15 minutes to make sure that medication disperses. You don't want to just stand back up again and have it run out. Use room temperature medications when you're dealing with vaginal or, well, really any mucous membrane. You don't want to shock your patient to death. Have it fairly, fairly warm, nothing cold. Don't take something straight out of the fridge and put it in somebody's ear or vagina. It's painful. Eardrops. If you have to administer eardrops, you need to make sure that they are indicated for otic use. You're going to pull the ear back and up if it's an adult, back and down for the child because of the difference in the angle of the eustachian tubes. When a child gets to be about 3 years old, the eustachian tubes go from being short and very straight to longer and a little bit more tilted. That's why often about the age of 3, if your child's had a lot of ear infections, usually magically around that age they stop getting as frequent because as the child grows, the eustachian tubes grow and change angles. For eye ointment, if it's ointment, you're going to not touch the tip of the container against the eye, but just squirt the ointment along the inner aspect of the lower lid. If you're giving drops, you have the patient tilt their head back and drop into the conjunctival sac, not on the eye itself. For a respiratory inhaler, make sure that the patient knows to inhale deep into the lungs. They can exhale, activate the medication, and inhale. Don't just squirt it in the back of their throat. It's not going to get there. They have to exhale first and then inhale as they are releasing that medication. On page 58, we see all kinds of information about giving different sorts of medications. 58, 59, 60. Make sure you read all those and be aware of where they are. Also, instructions for different topical meds are given on pages 59 to 60. One thing I want to call your attention to is the administering of rectal drugs. If you look at the picture on page 61, you see that the person is lying on their left side, sometimes on their right side, sometimes. If you are giving rectal drugs, of course, you want to do the same protocol as you do all the other drugs. You want hand hygiene, you want to have all the stuff you need, you want to check the 9 rights of medication administration, which you will hear about, forever. You want to check the drug order, you want to have all your supplies, especially, it says including lubricant, especially lubricant, and gloves. You want to identify the patient, make sure you've got hygiene definitely after and also before. Note the correct positioning. If you look at the figure G, you see the way the colon is arranged in the body. If you give an enema, you want that water to run in and then you want it to run down. You want it to get as high up in the colon as you possibly can, and it's going to go by gravity. Take your book and turn it upside down. What do you see? If the person is lying on their right side, then that liquid has to go uphill. It's not going to happen. You want them on their left side to follow the natural anatomy. A suppository, it doesn't really matter. They can be on their right side or their left side. You're just making sure that the suppository is instilled past the 2 sphincter muscles into the rectum, where it's going to dissolve and either be absorbed into the bloodstream if it's that kind, or provide a laxative into the rectal area. But anything with fluid, you got to make sure they're lying on their left side. And that is it for chapter 4. Like I said, read your book, read the ATI, and make sure you listen to these lectures at least once. I know they are not thrilling, I'm the first to admit, but sometimes hearing things as well as seeing it helps you rather than just reading, or worse yet, just looking up the answers quick when you have a quiz on it. That's not a good idea. You want to get it into your long-term memory, not just your short-term memory. All right, we'll stop here, and eventually I'll move on to the next chapter.